When you have a leakage in your house during monsoon, what do? Do you cover it with a plastic and create a temporary solution? Or do you find out the source of the leakage and then repair it? The latter one is a permanent solution. A temporary solution will provide momentary cover, but the leakage would keep arising every monsoon. On the other hand, finding the source of the leakage and repairing it would be the end of the problem. You must note that a temporary solution is easy to find and takes comparatively less time. A permanent solution, on the other hand, is difficult and takes a longer time. Similarly, when our body is affected by a disease, there are two ways of treating it. First, we can take medicines to reduce the effects of the disease. What do I mean by this? We take a tablet to reduce the fever, headache, and inflammation. However, the disease agents are just inactive but are still present in the body. What would be the alternate way of treatment? Killing the very cause of the disease, by which I mean the infectious agents, is a permanent solution. As we studied in our previous videos, drugs that are category specific can help kill the infectious agents. It is easy to kill bacteria as they have a specific biochemical process. Viruses, on the other hand, are difficult to be treated. We can only control them by using antiviral medicines. Why can't viruses be killed typically? In simple words, viruses do not have an independent existence. Without entering a living cell, viruses cannot multiply. That means they need a host in order to survive. Think for a moment then. If I want to kill a virus, what would I have to do? Can I kill only the virus? That is impossible because the virus is inside the cell. If I have to kill a virus, I must also kill the cell, thus damaging the organism. Therefore, we can only use medicines to suppress the activities of the virus, but we cannot completely kill it. So after you have a disease, you cure it and then you're completely fine, right? Is it as good as just being completely fit? Can we assume nothing happened and everything is back to normal? Well, not really. Firstly, diseases affect the smooth functioning of the body. Even after you have recovered from fever, you still feel weak and exhausted, don't you? The body functions may not be able to refer to full efficiency ever. There is a chance that you may not recover completely. Secondly, treatment of a disease is also very time-consuming. You may miss out on important events and work will keep piling up when you're ill. That's something none of us would really want, right? And thirdly, once a person contracts a disease, there are many chances of it spreading to others. This causes multiplication of the disease, which is not good for the people who are around you. So what's the solution? Have you heard the saying, prevention is better than cure? That's exactly what we can do. We must prevent the disease by taking specific measures. What are the general measures everyone can take? The main cause of the disease is the infectious agent. We must therefore prevent exposure to these microbes. How can we do that? Is it even possible? Well, though we can't prevent all exposure, we can surely reduce our exposure to the disease. We know the ways in which disease-causing agents are transmitted. Can you recollect those pathways? Airborne, waterborne, and vector-borne are the different types of diseases, and we must clean these pathways to prevent diseases. The air must be kept clean by less crowding, safe drinking water can be provided, and clean environments would reduce the presence of vectors. Another way to prevent diseases is by developing a strong immune system. When the body is well nourished with food, we can prevent diseases. These are the two general ways of preventing diseases. In our next video, we look at how disease can be specifically prevented.